Hi, I'm Pastor Stephen Broughton with the Senate Republican Executive Committee, Senate District 23 here in Texas. Under the guise of school safety, Governor Abbott and Lieutenant Governor Dan Patrick are seeking to legislate psychiatric examination of our children without parental consent. This effort to do so is an encroachment, an intrusion on our liberties and on our rights as parents to determine who will evaluate and examine our children. The Coalition for the Protection of Parental Rights here in the state of Texas are seeking your help to stop this legislation.
This bill also establishes the Texas Child Health Access Through Telemedicine Program, or TCHAT, another acronym, which will provide at-risk students with assessments and intervention through telemedicine. The goal is to have these in every region, partnering with local school districts. Students will receive 2 sessions, and then a determination will be made as to whether a referral for additional treatment is needed. Senate Bill 10 also expands residency opportunities in community settings. It promotes collaboration on mental health research among our health-related institutions, and it directs that judges be educated about mental health.
With child psychiatry access lines, an expert in child mental health, only a phone call away for the primary care physician or for the teachers who are struggling to understand Paula's behavior and her difficulties. A child mental health nurse practitioner would staff the rural location of the mental health center, or maybe a child psychiatrist could tele in using new technology. Her school teachers would be trained in a statewide plan for best practices in behavioral health in the classroom, and her treatment would be informed by new research that could bring truly individualized treatment within reach and expedite her recovery, placing her back on the developmental trajectory that we would hope for.
Representative Chairman Frank.
How consistent is the advice that a child is likely to get through a network between the different professions? I mean, it seems like there's just a tremendous variety of thought in what that advice may be in terms of, you know, the underlying reasons, as you mentioned. It's hard to imagine much consistency across the spectrum.
And I think probably what you're speaking to is how there are so many unanswered questions within psychiatry. We often talk about it being somewhat of an art instead of pure science, right?
And there's some that have been answered a long time and we ignore.
And that's absolutely true. The best practices are not well disseminated. But when there are, when things are left to clinical acumen and the diagnostician to answer rather than there being an available brain scan or blood test or diagnostic test that we can do to give you a solid, concrete answer, there's more variability in the answer that you're going to get, right? So if you go to your doctor and you get a tumor biopsy and they do, genotyping on that tumor, it's a very concrete answer. But when you're doing an interview with a patient and you don't have a blood test or a brain scan or an EEG that can give you an answer that's very concrete, it's a bit more variable.
So in the case you just read with the 6-year-old that was traumatized, abused, you're going to do brain scans and blood tests to see whether or not.
I think that's where the research potential is an unknown. We can't predict exactly where it will take us. I think there is potential for that kind of diagnostic test guiding treatment in the future. We've seen some of that with pharmacogenomics and the testing that they're beginning to do to look at how we can guide our prescribing practices based on people's genetic profile. That's just one example, but we're really early in that science. We're not there yet.
She has statistics. She said she and her husband read studies that showed that these blockers, and these blockers, hormone blockers, prevent this little boy from growing into a man. They stunt his growth and keep him in this prepubescent stage. And she said that might not be reversible, and there might be long-term effects not only for his body but for brain development. How on earth can this be deemed emotional abuse? And if it is, which it is in the UK, then what other parental decisions, that you make for your children, Alicia, or any of our viewers make for their children, couldn't be deemed emotional abuse if it doesn't fit the radical leftist narrative?
No, we do not know what this does to the body. There is no positive science to show that this would benefit this young man in any way who has Asperger's and is on the spectrum and the parents are saying, hey, he's 14 years old, let's hold this for a beat. Give him a year, give him 2 years, give him 4 years. Like the mother said, all of the statistics show they err on the side of not doing this to young children, and it is very scary to me how not only there's a medical community, there was an entire school here who called the government in on these parents. It's really scary.
It is. And by the way, this the reason that the government's threatening to put him in foster care, and by the way, he while the parents technically haven't lost custody permanently, the child is living with a family friend. Right. Mm-hmm. So the reason for this is, like you said, the school reported it to government watchdogs, you know, the social services in the UK, and social services created what they call a child protection plan. This is the definition. Mm-hmm. A child protection plan is a plan drawn up by the local authority. It sets out how the child can be kept safe, how things can be made better for the family, and what support they will need. The phrase in that, Alicia, that just absolutely scares me to death and should scare anybody who has a child is a plan drawn up by the local authority. That means a bureaucrat in the government can dictate how you have to raise your child under the threat of taking your child away from you. This absolutely decimates parental rights and gives all those rights to the government.
I'm the mental health supervisor for Austin ISD Police Department. I've served for nearly 37 years as a police officer. I've been a mental health supervisor within this department for 6 years. And during that time, we have 130 campuses that cover about a 235 square mile area of the city. Two troubling trends that appear to be occurring amongst our students. Our school counselors are faced with daily crisis incidents that demands most of their time, which does not allow them to serve the students who have merely academic needs. The calls range from severe mental health crisis to completed suicide on our campus during school time. Suicidal ideations and other severe mental health issues among our youth appear to be increasing, and we're seeing this on the ground. 875 CPS referrals related to mental health. Intensive counseling sessions are thousands.
Senator Hall.
Thank you, Mr. Chairman. You've been in the system for a while.
A long while.
What's your assessment of the uptick that we've had in the mental problems since 2009? That's kind of where it started. What do you think what are the contributing factors that make to that?
Honestly, I would start with saying that we're not doing the preventive work. We have got to start in our elementary schools. Those elementary counselors are so bogged down with other things, but we have got to get in the classrooms, and we've got to teach them the social emotional skills that they need to make good decisions and to make good choices.
Not quite my question.
Okay.
What caused the uptick in mental problems starting to grow? In 2009, we started to see a growth of it. I'm not talking about what do we need to do about it now, but we have not always had this problem to the extent we have it now. And it is, as you said, it's becoming epidemic.
And I think
So what is it that is the driver that is causing this?
I think it's a society problem. I think it just mirrors what's going on in our society. You know, we're getting away from teaching students skills at home and skills on how to get along and how to handle problems, and the fact that life is going to come with problems. And so I think that is a big contributor. What I'm seeing and what we're seeing in the schools is that a lot of students have the same problems that we had, in the past, but they're not dealing with it in the correct manners. They don't have the same skills we've had in the past to deal with it.
And they've gone through years and years without going into social emotional learning. We've had years of cognitive teaching where schools were to educate the children, to teach them knowledge-based education. And so we didn't have this social emotional bent that we have today. So
and that is our problem.
What is the change?
And I think that is it. I think that we taught a lot of that in the homes in the past. We taught a lot of that on our social media outlets like TV, things such as that. We don't have that nowadays. Our kids are totally bombarded with just thinking about themselves. We don't have people that are actually teaching these kids, how to handle the everyday problems. And so a lot of the same things that we handled when we were growing up in the past, these kids don't have the same skills to handle that same problem. So what we hear a lot of is instead, I want to cut myself, or I want to kill myself, I want to hurt myself in some way.
So you're saying that the school now is really assuming the role of the parent?
In a lot of ways, in a lot of situations, yes.
When you do a social and emotional assessment, and it indicates that there's some additional treatment, help needed, and the parents don't agree, what happens?
Well, what our hope is that we will, as counselors, develop a relationship with those parents that we can gain their trust, and we can show them, how those problems are affecting their students' learning. Every parent wants their child to be successful, and so we're hoping, by going that way, as counselors, that will be instrumental.
No, I understand that. I'm just saying, you do the assessment, and you say, the parents say, no, I don't agree. What does the school do?
Well, I think that we can still help that student in the sense that we're going to go into the classrooms and still do classroom lessons. There's tiers here, so we can still do the teaching part of it, and that student can still benefit from learning those skills by having a counselor on board, that is actually doing the preventive work, that's actually doing the teaching. Maybe not the individual. Usually when it's that sort of thing, the parents, are not in agreement with the individual counseling.
Okay, does the school go around the parents and maybe call in CPS or get somebody else?
If the student is in danger, of hurting himself or herself, or if we find that this is a severe mental problem, yes, then we go to what we do as counselors is we meet with the assistant principal, our principal, and we do come up with a plan, and then we do call the parent in, and then we will get assistance, of course, from our LSSPs, or maybe even, if we have a social worker on board, we will elicit their help to talk with the parent. Most of the cases I find that when we're talking about, how we can help a student and we're talking about a student's problems, most parents, are pretty on board with that. They're pretty concerned about it. Now, if the student is in danger, right, and the parent, does not respond, yes, we are going to call Children's Protective Services. We are going to report that parent to see if we can do other means. We also get our resource officers involved as well.
The issue of mental illness came up earlier, and the inference that it's the mentally ill that are shooting up schools. That's not quite a good characterization of the issue. The mentally ill are actually no more likely to commit crimes than anybody else. I appreciate the questions about whether there's parental consent for screenings. And I appreciate it because I really don't know the answer, right? We start getting into things like assessment. Well, is it a formal screening? Is it an assessment? And what is the trigger for further action? And I think we need to clarify that really carefully. Last week in another committee in the House, a school resource officer testified to the fact that Child Protective Services had been called on parents 785 times so far this school year over mental health issues, and that in a good number of those issues it was because the parents disagreed with the school's opinion on mental health. And he said that right after he said, well, we don't really have any science to back this up. That's scary. I've had a mental health screening case before, and I don't know that parents can be adequately informed of the ramifications of a false positive. In the case we had, a little girl was taken out of her home because her parents had a difference of opinion with the school people. And unfortunately, she was in a state hospital for months. She was restrained. She was injected with drugs. And it took an attorney, a reporter, us, a psychologist, and her doctor to get her home. And that's what we want to avoid as we move forward with these bills.
Glad to hear you say that.
Yes.
It was very clear from earlier testimony that they're actually doing screening, evaluation, making determinations, and going around the parents without permission. And that's not supposed to be, but it's real clear. I mean, when you talk about evidence-based assessments, what's the evidence?
Correct.
It has to come from assessments and screening. And that's going on today in our schools without parental permission.
That's our concern too,
Yes.
and
It's
the push
a
for
very
universal
valid concern.
Yes, and the push for universal mental health screening has been even worse because there's been talk of actually doing that in the school clinic and making the screening instrument part of the intake process. You know, we see it when we go to the doctor. I guess if you're over 50, you end up, you at least have a couple of mental health questions on your intake paperwork, or if you go into a hospital. But nobody talks to you beforehand and says, okay, so if we think that you are suicidal, your care is going to take a completely different trajectory, right? Nobody warns you first. And we worry about that being put onto potential violence and things like that. The best indicator of whether somebody is violent, in my opinion, is the same kind of training that the police get, where you're looking at an immediate risk. Once you get beyond that, you're into situations where you're having to predict the future, and none of us has a crystal ball. That's pretty much the way I see it.
In the issue of mental illness, it's not an exact science. It's and sometimes it's possible that we're confusing confusion in a child with mental illness. The kind of confusion that would come when they don't have good confidence in themselves. That's I think no one will disagree, one of the most important things for a child to have to feel stable is self-confidence. And when we had knowledge-based learning, where a student could learn something, pass a test, actually achieve something, they developed confidence in what they were learning, where they were going. But when we move over to the bent towards social emotional performance, and there's no right answer, it's all squishy out there. They have nothing to grab onto, nothing to hold on to. And so we're introducing more confusion into the little mind that's already confused from a dysfunctional, slightly functional home life and other life out there. And you couple that with the isolated life that they get by having this to communicate with. This is what they talk to. This is what they get their advice from. Between those three, we've got something that's feeding on itself here. And I feel that we've got a system that exasperates a problem rather than trying to work towards fixing it. And we end up with a confusion there of an issue where we have a confused mind as opposed to a mentally ill mind.
Yes, sir, we share your concern.
I'm Dr. Moira Dolan. I'm a board-certified internal medicine physician here in Austin. Thank you, Madam Chairman and members of the committee. I really appreciate being able to speak today. So this bill has several stated goals, all summed up in seeking to expand the delivery of mental health care services. Unfortunately, it continues the trend of taking the complex field of human relations and putting it into a tiny little biomedical box, because it is a medical approach. Despite all what you heard this morning, this is basically a medical approach. This bill calls for academic medical centers to be the central figures in the proposed consortium. Medical centers offer medical solutions, not social, not economic, not skill enhancement or character development. And the medical solution for mental health problems is one thing right now, and that's medication. After all, medical schools are where most of the drug research in this country gets done, to the point of earlier testimony. Now, a requirement of this bill is to use evidence-based tools, and you heard that phrase here this morning. That concept, evidence-based, is highly respected, almost revered in medicine, but it is stretched to unbelievable thinness when applied to the one example given in the language of this bill, telemedicine. There is evidence that telemedicine increases the number of individuals interfacing with psychiatrists, sure enough, but this is not evidence of a relevant outcome. In medicine, we look for meaningful results. The model psychiatric telemedicine program in Texas, as you know, is called TUR, and to date, it has reported no evidence-based meaningful outcomes. I will leave you with a straightforward summary of the immense validity of problems with Twitter. I provided that here. Now, I do have actual evidence to share with you today. Between 2007 and 2017, this state has relentlessly increased spending on mental health access and has increased the numbers of people engaging with psychiatry. Where are the outcomes from all this expenditure and this increased utilization? Well, according to Texas-specific data from the CDC, the suicide rate among 15 to 19-year-olds in this state has gone up 43% in that same 10 years. We're talking billions of dollars here. Now that is objective evidence. I don't have time to go into it, but I urge you to read the just published UTMB study that debunks the link between mental illness and gun violence.
SB 10 and SB 11 represent the federal merging of education and mental health in Texas. Both of these bills are a priority for our governor, Greg Abbott, this particular legislative session. SB 10 focuses on accessing Texas's youngest children on our local public school campuses and assessing their mental health behavior in the name of preventing school violence. SB 10 creates a consortium that will be composed of totally unelected body. It will be controlled by the chairs of the Department of Psychiatry of 12 university campuses, the Texas Health and Human Services Commission, which is an agency with 60,000 employees and an $80 billion biennium budget, 3 nonprofit organizations that focus on mental health care, which would be appointed by the 12 chairs of psychiatry, and any other entity that the chairs of psychiatry deem to be necessary. And the chairs of the university psychiatry departments will have majority control over this. Psychiatry uses medicine to solve issues. And my question is, if most mass shooters have a history of psychotic drug use, what is the potential that more drug prescriptions are going to solve mental health issues? Our schools should not be psychiatric evaluation clinics. We don't take our children to the psychiatrist to learn their ABCs and their math tables. We shouldn't be taking them to school, to the local school campus, to be mentally evaluated for behavioral health. And also these mental health assessments could be a red flag, could produce a red flag law. In other words, the child could be asked, do Mommy and Daddy have a firearm at home? How about Uncle Bob and Aunt Lucy? How about the next door neighbor? There's something of great concern here just beyond the mental health of the child. If a parent chooses to seek alternatives or refuse the drug treatment that is suggested by these psychiatry departments of psychiatry, Child Protective Services could very well end up on the front doorstep of this family.
There has been a transformation in education over many years, but it was put in overdrive by the Obama administration. It's that transformation in education away from reading, writing, math, and history to attitudes, values, beliefs, and behaviors. And if you look at the National Democrat Party platform, you'll see this laid out, this shift in the funding for it. Unfortunately, here in Texas, we have Texas Republicans who are pushing these same policies. And it's clearly seen in Senate Bill 10 and Senate Bill 11, which are on the priority list. It's interesting to note that in 2001, with No Child Left Behind, that was the beginning of a national universal database system on students. It was illegal to have a national database, so what they did is set up 50 separate database systems. In 2009, with the stimulus package, that database system was upgraded. Texas took $18+ million. Then, in 2012, the Obama administration changed the regulation on the Family Education Rights and Privacy Act to say that our children and their teachers' private data can be collected without consent in the name of education research. Then in 2014, Congress passed WIOA, the Workforce Innovation and Opportunity Act, which basically binds education under the Department of Labor, Department of Health and Human Services, Department of Defense, and Department of Education. So when those federal departments send grants and federal money back to the state, we must align with the strings that they set forth. And those strings were put in place in 2015 with the reauthorization of the Elementary and Secondary Education Act, now known as the Every Student Succeeds Act. So when those federal dollars come to the state, we must align to the Common Core College and Career Readiness behavioral standards being mandated by the federal government. Unfortunately, in 2019, Congress passed FEPA, the Foundations for Evidence-Based Policymaking. And what this does, it makes legal the interoperability of all of these agency databases, in fact, setting up a universal database system on students from preschool through the workforce. In Texas, these bills, Senate Bill 10 and Senate Bill 11, set up the infrastructure for that for those federal dollars to be used and for the behavioral data to be collected on students. This is very concerning because they've set this system in place where parents don't have the opportunity to opt out. There is no consent. And so we are standing tall against this, and we ask you to join us